Parents want to make the right decisions to protect their children's health, particularly when it comes to the COVID-19 vaccine. But with so much information out there, it can be difficult to sort through it all. Alison Bogle with Austin Family Magazine joins us now with some advice on navigating the COVID information maze. Good morning, Alison. How are you today?
Good morning. Happy Thanksgiving. It's nice to see you.
There is a lot. There has been a lot of information for months and months now. And number one to dissect here is the drug development process.
Right. So I consider myself reasonably well informed about COVID vaccine, particularly when it comes to my children. But I had no idea what the drug development process was like until I read this article that was in our recent issue. And so really, I wanted to tell you about the 4 phases of the trial phases of drug development so that people have an understanding. So in the first phase, the drug is tested on a small group of healthy patients. And so really they're looking at safety, different doses and side effects, and then what does the body do with that drug? So how does it absorb it, distribute it throughout the body, metabolize it, and excrete it? So looking at, how quickly will it start working and how effective will it be and for how long? So once trial 1 is complete, or phase 1, then we move to phase 2 of the trials. And this is a targeted controlled trial, which what on earth does that mean? So control means we're going to have a placebo group that receives just a medication that we already know or is not the drug. And then a targeted trial means that we're actually testing it on a population that might benefit from the drug. So for example, if it's an asthma medication, it would be tested on people who have asthma. And this is a group of about 300 people, it tends to be. So again, in all these trial phases, we are testing for safety and efficacy as well. So then once the drug passes trial phase 2, we move on to phase 3. And this is a much larger phase. So we're going to have, it could be up to several thousand patients. And researchers are really testing carefully here. They are in every phase, but again, we're instituting the controls, and also they may test across various geographic regions. And then once a drug passes phase 3 of the trials, then it's submitted to the FDA for approval to bring the drug to market. And then we have phase 4, and that's where our kids come into play. So once the drug is already in the market, that's when phase 4 trials begin. And in these cases, we're looking at using it in a different population, like young children, looking at different dosages, and also seeing, can the drug be used for other things? So there's quite a bit of rigorous trial system that the drug goes through before it reaches our children.
That should answer a lot of questions. But if we're looking for other factual information, more so in terms of what is not a myth, learning the facts, what's the best place to go?
Right, there are some great resources, and I believe you're going to put them on the screen for us. But the CDC has some fantastic resources, both to understand the process, and then another section that talks about common myths and how to bust those myths and to provide parents with the actual facts.
And then finally, whose advice do I trust or should I trust?
Right, that's a hard one, and it is not a problem in any situation with our kids to seek out more information. Don't ever hesitate to contact an expert if you're trying to make decisions about your child's health. And of course, your pediatrician is a fantastic resource. So they are trained to evaluate various therapies for pediatric benefits. So you can talk to your pediatrician, share your concerns, and then your pediatrician knows your child, so they can even give tailored advice for your child.
All this information in the latest issue of Austin Family Magazine, which is on newsstands now, or of course we could check it out online, austinfamily.com. Alison, thank you so much. You've given us a lot to think of, and I hope you have an amazing Thanksgiving with your family.
Thank you. You too.